One of the most common nutrient deficiencies in North America could be putting you at risk of developing type 2 diabetes. So a recently published systematic review of 60 different studies told us that the population tested, those with the higher levels of vitamin D, had a lower risk of developing type 2 diabetes. They also found that if a diabetic were deficient in vitamin D, if they supplemented those same patients with vitamin D, they saw improved insulin sensitivity as well as improved beta cell function. Now, this is important because it's a simple test. Most North Americans are on the deficient side, 20 to 25 nanograms per milliliter of vitamin D. Optimally, most people, the endocrine societies are going to recommend between 30 and 50 nanograms per milliliter. Most functional medicine practitioners are going to want to see that more in the 60 to 80 range, knowing that under 100 would be fine. Toxicity can be seen, so you can hurt yourself by taking too much of this. Anything over 150 nanograms per milliliter is going to be toxic levels, so you do need to do this under supervision. But something to look at, simple blood test. Go to your doctor, 25-hydroxy vitamin D test. Check that out. If you are low, supplement. That may be something depending on where you are. If you're an indoor person, you need to supplement right year round. If you are an indoor person in the winter and don't get a lot of sun where you are, depending on where you live, it may be just something you need to supplement with in the winter months. But something to stay on top of. 25-hydroxy vitamin D test, get it done. Decreased levels, not causation, but decreased levels are seen as a higher risk for developing type 2 diabetes. And if you are a type 2 diabetic who is deficient, supplementing with vitamin D can increase insulin sensitivity and improve beta cell function. Those are the cells in your pancreas that produce insulin. Something important to keep an eye on, always here to help.